War leaves a trail of destruction that extends far beyond the battlefield. While the immediate victims of armed conflicts are often the focus of headlines, there are countless invisible victims whose suffering continues long after the fighting has ceased. Among these hidden victims are medical facilities and healthcare professionals. Healthcare workers who risk their lives to provide care amidst chaos. Their stories are a testament to the human cost of war and a reminder of the urgent need to protect those who are dedicated to healing. The destruction of medical infrastructure and attacks on health workers have become tragically common occurrences in modern warfare. These acts of violence not only deprive civilians of essential medical care, but also erode the fundamental principles of humanity that support the international law. When hospitals turn into battlefields and doctors and nurses become targets, is a stark reminder of the brutal reality of war and its devastating consequences for innocent lives. In the face of unimaginable suffering, medical professionals in conflict zones serve as beacons of hope and resilience. Work tirelessly, often with limited resources and under constant threat, to provide vital care to those in need. Their commitment to their oath to heal transcends the political and ideological divisions that fuel the conflict, demonstrating the enduring power of human compassion. The importance of facilities. The work of medical professionals and health workers in conflict zones cannot be overstated. They are not mere providers of healthcare, are lifelines for communities shattered by violence. Hospitals and clinics serve as sanctuaries for the wounded and the sick, offering a ray of hope amidst despair. The presence of health workers provides a sense of normalcy and safety. In environments marked by fear and uncertainty, their dedication to their patients, even in the most difficult circumstances, it is a testament to their unwavering commitment to human dignity. The deliberate attack on medical facilities and personnel is a flagrant violation of the law. International humanitarian. These acts of violence not only result in the immediate loss of lives and injuries, but also have long-term consequences for the health and well-being of communities. The destruction of hospitals and clinics can paralyze healthcare systems, leaving civilians without access to essential medical services. One of the best documented examples of attacks on healthcare in recent years is the ongoing conflict in Syria. Since the beginning of the war, hundreds of attacks on medical facilities have been reported. Many of them allegedly carried out by government forces and their allies. These attacks have resulted in the death of hundreds of health workers and the displacement of countless others, leaving a devastating void in the already strained healthcare system. The impact of attacks on healthcare extends far beyond the immediate victims. When medical facilities are destroyed and health workers are killed or injured, it creates a domino effect that is felt throughout the community. The loss of access to healthcare can have devastating consequences for people with chronic diseases, pregnant women and children, who are among the most vulnerable in times of conflict. The media play a crucial role in drawing attention to these atrocities and hold those responsible accountable. When reporting on attacks on healthcare, the media can help to increase international pressure on the parties in conflict that respect international humanitarian law. Furthermore, media coverage can help raise public awareness about the cost, humanitarian law of war, and the importance of protecting health workers and medical facilities. Ultimately, it is through a combination of advocacy, accountability, and a collective commitment to defend the principles of humanity that we can hope for, create a world where hospitals are places of healing, not battlefields.